Question number 1. Which of the following is a priority nursing intervention for a patient with difficulty in breathing? The right option is option B. Elevate the head of the bed. Question number 2. The best method to prevent bed sores in bedridden patients is. The right option is option B. Frequent position changes. Question number 3. Before feeding a patient through a nasogastric tube, the nurse should first. The right option is option B. Check the placement of the tube. Question number 4. When caring for a patient with a urinary catheter, the nurse should. The right option is option C. Keep the drainage bag below the bladder level. Question number 5. Which is the most appropriate nursing intervention for a patient with dyspnea? The right option is option B. Elevate the head of the bed. Question number 6. Which of the following is a sign of effective pain management in patient? The right option is option B. Normal facial expressions and relaxed body. Question number 7. The nurse is preparing to give a bed bath. What is the first step? The right option is option B. Close the room door. Question number 8. The priority action after a patient vomits is to. The right option is option D. Turn the head to the side to prevent aspiration. Question number 9. Which of the following is a psychological need according to Maslow hierarchy? The right option is option D. Belonging. Question number 10. A patient is at risk for falls. What is the first action by the nurse? The right option is option B. Remove clutter from the environment. Question number 11. In case of fire in a hospital, what is the first action a nurse should take? The right option is option C. Rescue the patient. Question number 12. A nurse notices a pressure ulcer on a bedridden patient. The first action is to. The right option is option C. Reposition the patient frequently. Question number 13. While measuring blood pressure, the nurse must. The right option is option C. Support arm at heart level. Question number 14. Which type of isolation is used for tuberculosis patient? The right option is option C. Airborne. Question number 15. Which is a subjective sign collected during nursing assessment? The right option is option A. Pain. Question number 16. Before giving oral medication, the nurse should check. The right option is option D. Swallowing ability. Question number 17. When should hand hygiene be performed during patient care? The right option is option D, all of the above. Question number 18. Which nursing intervention prevents post-operative complications? The right option is option A, encourage deep breathing and coughing. Question number 19. Informed consent is usually obtained by the. The right option is option B, doctor. Question number 20. Pressure ulcer commonly develops on. The right option is option C, heels. Question number 21. Which is the best position for a patient in shock? The right option is option B, Trendelenburg. Question number 22. Oral care in unconscious patients is done. The right option is option D, every 2 hours. Question number 23. Which of the following is a sign of infection at a wound site? The right option is option B, redness and swelling. Question number 24. A nurse should report which of the following immediately? The right option is option C, change in level of consciousness. Question number 25. Which nursing action promotes circulation in a bedridden patient? The right option is option C, passive range of motion exercises. Question number 26. Which is a component of holistic nursing care? The right option is option A, emotional and spiritual support. Question number 27. The most accurate method of medication administration verification is. The right option is option D, name and ID band. Question number 28. What is the main purpose of a nursing diagnosis? The right option is option A, guide nursing interventions. Question number 29. A nasogastric NG tube is primarily used for. The right option is option C, feeding and medication. Question number 30. What is the most effective method to prevent the spread of infection in healthcare settings? The right option is option C, hand washing. Question number 31. What should the nurse monitor in a patient receiving intravenous IV fluids? The right option is option B, IV site for swelling. Question number 32. What is the priority nursing intervention for a patient with chest pain? The right option is option D, administer oxygen. Question number 33. When positioning a patient with right-sided weakness, support should be provided to the. The right option is option B, right side. Question number 34. The most appropriate time to assess pain is. The right option is option C, before and after any procedure. Question number 35. Which of the following is a sign of dehydration? The right option is option A, decreased urine output. Question number 36. A nurse is responsible for aseptic technique during. The right option is option B, dressing a wound. Question number 37. How often should vital signs be monitored in a critically ill patient? The right option is option C, hourly or as ordered. Question number 38. If a patient starts choking while eating, the nurse should. The right option is option D, perform Heimlich maneuver. Question number 39. The best method to confirm angio-tube placement is. The right option is option A, X-ray. Question number 40. A patient with diabetes should have their feet assessed. The right option is option C, daily. Question number 41. What is the best nursing response to a patient's emotional distress? The right option is option B, encourage expression of feelings. Question number 42. The main sign of hypoglycemia is. The right option is option B, sweating and confusion. Question number 43. When giving a back message to a patient, the main purpose is to. The right option is option C, promote circulation and relaxation. Question number 44. When feeding a semi-conscious patient, the best position is. The right option is option D, high fallers. Question number 45. The nurse documents PR temperature. What does PR means? The right option is option A, per rectum. Question number 46. What is the normal oxygen saturation range in a healthy adult? The right option is option A, 95 to 100%. Question number 47. A nurse finds a patient unconscious on the floor. What is the first action? The right option is option A, start CPR. Question number 48. A nurse documents that a patient is alert and oriented multiplied by 3. This means the patient is aware of. The right option is option A, person, place and time. Question number 49. While performing oral care on an unconscious patient, the most important precaution is to. The right option is option C, turn the patient to the side. Question number 50. A major role of the nurse in the rehabilitation phase is to. The right option is option B, promote patient independence.